Hi, this is Diane Carvo, RN with Caregiver Relief. Today's topic is on how to prevent dementia. I am asked this question frequently by family members of loved ones who have dementia. Many worry that their children or grandchildren may develop this terrible disease. First, let's review what is dementia. This is an umbrella term for a variety of different conditions that affect the memory, that causes difficulty with thinking and reasoning skills, and the inability to function at work or in life activities without a struggle or without requiring some sort of help. Before we address how to prevent dementia, it's important to note here that there are over 100 different types of dementia. Alzheimer's disease is the most common type of dementia. This is associated with the sticky protein that builds up on the surface of the brain, and they're described as taus, T-A-U-S, and tangles. The second most common dementia is Lewy body dementia. I've done a podcast on Lewy body dementia, so I'll just touch briefly on this form of dementia. It's also that has a buildup of protein, but this protein is in the white matter in different regions of the brain, which is deeper in the brain versus on the outer edges of the brain. Vascular dementia is the third most common type of dementia. It is the result also of a plaque buildup in our arteries. This buildup causes narrowing of the arteries that supply blood flow to the brain. The good news about vascular dementia is that it is the most preventable type of dementia. You will hear doctors tell you about what is good for your heart is also good for the brain. So when it comes to vascular dementia, that is very true. As we discuss how to prevent dementia, I want to make sure you're aware that a person can develop more than one type of dementia. It has been found during autopsies that an individual that has Alzheimer's may also have a type of vascular dementia. As I have covered here, there are over 100 different dementias, and a person can develop more than one type of dementia. So, as we discuss dementia prevention, I recommend to my clients always prepare as if you're going to develop the disease and make lifestyle choices to prevent developing dementia. At the present time, there is no way to prevent all types of dementia. Scientists are still investigating how the condition develops. The good news is there is sufficient evidence that making healthy lifestyle choices can help you decrease your risk of developing dementia as you age. Brain changes can start decades before dementia symptoms appear. Researchers believe that dementia starts as long as 20 years before we see the signs and symptoms of dementia. The earlier you begin preserving your cardiovascular health, the better for your brain. There's a huge benefit to improving your blood vessel health. It's important to help you avoid a stroke, heart attack, and other serious diseases. I want to introduce the risk factors for developing dementia, and then I'm going to break those risk factors down based on the conditions that may cause dementia. A risk factor are things that increase your likelihood of developing a condition such as dementia. A risk factor includes environmental, genetics, and lifestyle choices. I'd like to tell you that there are some dementia risk factors that are difficult or impossible to change. These include age. The older you get, the more likely you are to develop dementia. But as I've mentioned many times before, dementia is not a natural part of aging. We are seeing individuals well over 100 years of age still work and have incredible memories. So let's dispel the myth that dementia is a normal part of aging. Another risk factor is your genetics. That does not mean that genetics can cause dementia. there are some genetic factors involved in some less common types of dementia. I address this topic in detail in my podcast on Is Dementia Hereditary lesson in this series. Remember, dementia usually develops because of a combination of genes, environmental factors, and lifestyle choices, such as smoking, drinking excessively, or living a sedentary lifestyle. Another risk factor that continues to contribute to the development of dementia is having a lower level of education. Don't get worried here. That does not mean those with college educations have less risk of developing dementia. The key to prevention is to learn something new and different as often as you can. It's about creating new connections or neural pathways between the brain cells. Getting out of your comfort zone and learning something new and different creates those new pathways. I have a list of other risk factors that may also be important to contribute to dementia. These include hearing loss. A research study in 20 suggests that hearing loss causes dementia. In fact, it is believed that 8% of dementia cases are caused by hearing loss. There is a study being conducted now that is trying to determine if whether the use of hearing aids can potentially reduce brain aging and the risk of dementia. The study is to be concluded in 2023. I'm actually looking forward to the results of this because so many seniors suffer from hearing loss. And I've learned over my 50 years of nursing that so many seniors don't want to wear those daggone hearing aids. Many see them as for old people. And I think present technology and making hearing aids so small and discreet now that this will overcome the objection to wearing them. If this study does determine that hearing aids prevent dementia, that could be a deal breaker for the vain senior who does not want to be perceived as old. And Lord, there's a lot of us out there. Another risk factor in developing dementia is untreated depression, loneliness, or social isolation. Also, a sedentary lifestyle, such as sitting for most of the day, is another risk factor that may contribute to the developing of dementia. Many studies have concluded that by modifying our risk factors, we are able to change our risk of preventing dementia by around 1/3. Hey, I take 33%. That's good. That's substantial. So this is the reason why I recommend that you live as if you're going to develop dementia. Just making a few changes can prevent or at least delay the progression of the disease. We've discussed the risk factors that can contribute to developing dementia. Now let's focus on the dementia risk factors based on a cause. As I mentioned earlier, experts agree that what's good for the heart is also good for your brain. Healthy lifestyle choices can help prevent cardiovascular diseases such as stroke and heart attacks. These are risk factors that I previously discussed at the beginning of this lesson. Cardiovascular diseases are risk factors for developing not only Alzheimer's disease, but also vascular dementia, the two most common types of dementia. This means you can reduce your risk of developing dementia by eating a well-balanced diet, maintaining a healthy weight, exercising regularly, and drink alcohol in moderation within recommended limits. A study that surprised me is one that shows that non-drinkers are more likely to develop dementia than a person who drinks in moderation. My first response was, oh, I guess I need to start drinking. I'm an adult child of an alcoholic, and I was never much of a drinker. I'm the 1 in 4 in the family that doesn't have an addiction to drugs or alcohol. Mine's food. But don't recommend that you start drinking if you've never been a drinker. And those recovering from alcoholism should continue to work on their program and just avoid alcohol. For those that want to avoid cardiovascular disease and vascular dementia and you smoke, you just have to stop smoking. Hey, I understand that's not easy. If you want to avoid strokes and other cardiovascular diseases that lead to dementia, it'll be worth it. I can't tell you how many smokers and ex-smokers that count the days years later and still wake up wanting that cigarette. It's a terrible thing. So you've got to support those that want to quit smoking and continue to stay off the cigarettes. Oh, and vaping. It's as bad for you as smoking. Sorry. Modern medicine has discovered breakthrough techniques as well as medications to help your blood pressure within a normal, healthy range, thus decreasing your chances of preventing dementia. It is estimated that 1 in 3 cases of dementia is preventable. Wow. Did you hear that? It is estimated that 1 in 3 cases of dementia is preventable. You can't do anything right now to stop or reverse the underlying mechanisms of Alzheimer's disease. However, you can do something if you have high blood pressure and vascular disease risk factors. So now let's talk about diet and dementia. So if you eat a diet that's high in processed foods and saturated fat, salt and sugar, and low in fiber, you're at a risk for developing high blood pressure, high cholesterol, becoming overweight or obese, and developing type 2 diabetes. The key to dementia prevention is lifestyle choices that include eating a healthy, balanced diet. Doctors recommend following the Mediterranean diet. It is rich in fruits, vegetables, and unsaturated fats. Which leads me to how your weight can put you at risk for developing a type of dementia. When you are overweight or obese, this can increase your blood pressure and the risk of type 2 diabetes. Alzheimer's disease has been actually called the third type of diabetes. There is a strong correlation between the insulin resistance in the body that leads to type 2 diabetes. The insulin resistance in the brain can lead to the protein buildup and tangles of Alzheimer's disease. To decrease your chances of dementia is to check on your weight and keep it at a healthy range. For those of you that are overweight, hey, I get it. I struggle with my weight all my life. Just losing 5 to 10% of that extra weight can decrease the risk. As we age, many of us struggle to keep our weight in a healthy range. Believe me, I know it's not easy. I take one day at a time. And I recommend that you have a discussion with your doctor on your weight. Medicare may cover a consult with a dietitian or get you into diabetes classes to learn what you can do to reach a healthy weight. A sedentary lifestyle is another risk factor that contributes to developing dementia. I have to tell you, had a dear friend, 82 years old, still working as an RN in giving immunizations. And she's always been a very active person. And recently, let's just go with COVID happened and they shut her down. And I can't tell you, it's been 2 years. I'm in South Carolina. We were open the whole time, but because her fear of getting COVID, she stayed in the house. And I see her often, but I can see how she's deteriorating physically as well as mentally. And she's also hard of hearing and doesn't wear her hearing aids because they're for old people. So I got to tell you that one of the most important dementia prevention strategies is exercise. And that's a strategy that we can control. The lack of regular physical activity can increase your risk of cardiovascular disease. A sedentary lifestyle can contribute to being overweight or obese. That can lead to type 2 diabetes, all of which are linked to a higher risk of developing dementia. Aging seniors that do not exercise are also more likely to have problems with memory or thinking, and that's also known as cognitive ability. Getting the recommended amount of exercise is not as difficult to achieve as you might think. Just a 30-minute brisk walk 5 times a week can make a difference. And if you don't want to walk, try cycling or even dancing. I can't tell you how many seniors do ballroom dancing or square dancing. That's just wonderful. I love it. Because I don't know how to dance. I need to learn, though, I'll tell you. And that's something new and different that I can do for my dementia prevention program. So many seniors sit more than they should. So try to get up and move around regularly. I make myself get up and take a walk outside or just around the house every 2 or 3 hours. I suffer from chronic pain, and there's days when every morning I get up, I walk a dog, I get up and walk, but I don't walk as much as I should when I hurt, and that's not good. I just get out on the beach and walk. But I've learned I park farther away from the store to walk more. I walk up escalators, and I try walking around when I'm on the phone. Remember, you can get those 30 minutes a day in just doing 10 minutes at a time, and it still makes a difference. So make an effort every day to get moving more. And another dementia prevention strategy we discussed is drink alcohol in moderation. Drinking excessive amounts of alcohol increases your risk of cardiovascular diseases and some cancers. Excessive amounts of alcohol are as damaging to your nervous system and your brain. Heavy drinking has been strongly linked to developing dementia. Alcohol dementia is real. It is reversible if the drinking is stopped early in the disease process. The nurse in me has to remind you that those that want to quit drinking, do it with the support of a professional. Your body becomes adjusted to your intake. It develops a tolerance. So if you've met that tolerance by drinking maybe a little more every day to get your buzz. So if you stop suddenly, withdrawal can occur. I have seen many NDTs, and it's not pretty. Even if you have a 6-pack a day, I know that's not a lot, but if you're a person who has 6-pack a day, that you build up a tolerance to that. And when you go into surgery or whatever, you need to let them know because your body can go into withdrawal. The next lifestyle choice that affects developing dementia is smoking. Smoking causes your arteries to become stiff and narrow. This causes your blood pressure to raise beyond healthy parameters. Smoking also increases your risk of cardiovascular disease as well as several types of cancer. So I recommend that you seek help to quit if you smoke. And there are many programs out there that can help you be successful. I mentioned earlier that untreated depression leads to dementia. There's a complex relationship between dementia and depression. There are many factors that play a part in that dynamic. Untreated depression affects an individual's ability to be social and engage in mentally and physically stimulating activities. For those that have an aging senior in your life, depression and apathy or lack of interest in life can be one of the first signs of dementia itself. So if you're concerned that you or a relative or friend may be depressed, suggest a visit to your primary care MD. Ask to be tested for depression. They can refer you to cognitive behavioral therapy or talk therapy. For those that suffer from treatment-resistant depression, please listen to my podcast on ketamine and MDA-assisted therapy, a breakthrough treatment helping those with depression, PTSD, chronic pain, migraines, and addiction. How to prevent dementia starts with having a discussion with your primary care physician and discussing if you are at higher risk to develop certain health problems that would lead to developing dementia. These would include heart disease, diabetes, kidney disease, stroke. And if you're listening and over the age of 65, you should learn the symptoms of dementia to watch out for. Making healthy choices and lifestyle changes in your 30s and 40s can make a difference to decrease your dementia risk. Talk to your doctor about strategies to guard against developing cardiovascular disease. Again, what's good for the heart is good for the brain. I'm Diane Carbo with caregiverrelief.com. If you're a caregiver, remember, you are the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-care, learn to be gentle with yourself, and practice stress management techniques because you are worth it.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.